Hello, I'm Mummiع. In the last video, I mentioned how vitamin D is so important in maintaining your healthy bones, keeping you away from diabetes and obesity. In this video, I'm going to mention how vitamin D is so important in keeping you away from depression, and I'm going to be answering the question why vitamin D is very important in the survival of COVID-19 patients. Let's go. Vitamin D is shown scientifically to reduce symptoms of Alzheimer's disease, multiple sclerosis, and Parkinson's disease, and many other diseases associated with the nervous system. What it does is that it increases the production of nerve growth factors, and those factors allow nerve cells within the brain to regenerate and keep regrowing within a healthy cycle. And if any cell goes out of control and wants to change into a tumor, vitamin D will upregulate the molecules that are needed for the cell's death, or as we call it in medicine, apoptosis. In our brain, there's an area called the substantia nigra, and this area is responsible for dopamine production. And guess what? Vitamin D has receptors in this area, and when it binds to those receptors, it upregulates the production of dopamine. If you don't know what's dopamine, dopamine is a neurotransmitter that allows the communication between nerve cells of your brain. It's also needed for you to feel euphoric, happy, motivated, and most importantly, for the sleep cycles. It's also needed in muscle contraction, preventing you from feeling fatigue. That's why people who have vitamin D deficiency may have unnecessary fatigue. They're exercising, they're eating healthy, they're doing whatever that needs to be done for a healthy person, but they feel fatigued. Any abnormality of dopamine is gonna make you feel depressed. Lack of motivation is also a symptom. You're gonna also feel that you lost interest in life and that nothing is able to make you happy. So now that you know what dopamine is, vitamin D is shown scientifically to increase the production of dopamine. And some of you may be wondering why people that don't get enough sun exposure, like people who live in the UK or maybe like in Alaska, are more prone to depression than those people who live beside the equator. So now that you're convinced that vitamin D is a true hero in medicine and you want to start taking it, so what are the proper sources of vitamin D? You can take it from fatty fish, yogurt, egg yolks. You can also take it from supplements, and you also can take it without paying any money by getting 20 to 30 minutes every day of sun exposure. And if you ask me, I think that cod liver oil supplements are the best. It's not because they give you a high levels of vitamin D only, it's because they are having vitamin A and vitamin E and omega-3 fatty acids within them. Last thing to mention, vitamin D is a fat-soluble molecule. Therefore, if you take it on an empty stomach, you are gonna barely absorb anything. So you should take it with a fat meal that will allow the absorption of vitamin D. One more thing, never take vitamin D supplements before you go to sleep, because those are fat-soluble molecules, as I mentioned, and they will wake you up at night several times to go to the bathroom, and you don't want that to happen. They also disturb your melatonin levels, which are responsible for your sleep cycle. I'm so happy that I was able to deliver this important information for you. Please make sure to understand it and apply it to your life, as it's able to keep you away from COVID-19, depression, obesity, diabetes, and bone fragility, which we call osteoporosis. Take care of yourself and your family, and see you later.